Hi everyone, my name is Mackenzie and I'm going to be presenting a case study on glomerulonephritis. Mr. Little is a 76-year-old male who presents to the emergency department with severe back pain, headache, and generally just does not feel well. Mr. Little states that when he looked in the mirror, he noticed that his face and around his eyes seemed swollen. He has felt very tired, has been experiencing chills, and reported having dark urine over the past few days. Vitals upon admission included a blood pressure of 168/98, which indicates hypertension, a temperature of 101.9, indicating a fever. His heart rate is 98, oxygen saturation is 96%, his respiratory rate is 18, and he is reporting 8 out of 10 pain in both his lower back and his head. When discussing medical history, Mr. Little stated that he had had strep throat roughly 2 weeks ago. Mr. Little also has a history of type 2 diabetes, but denies any autoimmune disorders. I am diagnosing Mr. Little with glomerulonephritis due to his recent strep throat infection and his current clinical presentation. This occurs when the glomeruli in the kidneys become inflamed from the buildup of antibodies to the streptococcal infection, leading to swelling, flank pain, and poor kidney function. Dark urine is common with this condition and results from red blood cells and protein in the urine related to increased capillary permeability. Hypertension is often a result of decreased GFR and increased renin secretion. To confirm this diagnosis, I am going to order BUN, creatinine, GFR, and CRP to evaluate Mr. Little's kidney function and inflammation. I suspect his BUN and creatinine will be elevated with a low GFR. I also anticipate that his CRP will be elevated, indicating increased inflammation. I am also going to order a urinalysis, and I anticipate the presence of red blood cells, protein, and erythrocyte cast, which are more specific to glomerular origin. I'm going to educate Mr. Little about reducing his salt and water intake, prescribe an antihypertensive, as well as glucocorticoids to reduce inflammation. I am also going to prescribe him penicillin if his strep throat infection is still present. Thank you very much. I hope you enjoy.